Greetings and welcome to the Health Light. This is Dr. Singh, TCM physician, food therapist, herbal forma therapist, and certainly acupuncture. Please take the time out to click the like, also the subscribe button. I'll wait while you do that. Today, the food recommendation, I'm going to give that to you in a few minutes, but I need to show you what it is because it is very confusing. You may select the wrong one. I like to pay close attention to a condition. That is a stroke. Stroke is thought of as being a condition that only the elderly will get. That is not true. That is false. A stroke in TCM is called wind stroke. It's just a different name, but it means the same exact thing. These are people contributing factors such as narrowing of the vessels and gradual blockage of the vessels. Amongst that is a high blood pressure patient and or diabetic. I didn't say that because you have that, you're going to have a stroke. I'm just explaining that these are the contributing factors towards a stroke. In this particular condition, everyone is affected differently. For instance, a person could be paralyzed on the left. A person could be paralyzed on the right. It could be upper and lower body. It could be upper and lower body, right or left. However, there is some indication of a mild neurological effect where their speech is somewhat different. Not all patients, but some. So these are some of the characteristics pertaining to a stroke, and we call it in TCM wind stroke. This condition is something that's very devastating to the patient because the patient is now realizing they have lost their total independence. They may even be experiencing mood swings like depression. Why? Because they lost their sense of independence. They're not able to reach for things anymore. They need help. They need aid. And what happens? What occurs is the caregiver sometimes gets frustrated because they're there with the patient constantly trying to help this loved one to get better and regain their own independence. I am going to suggest this. Patients need someone that's going to be attentive, going to be positive, and also going to take the time out to provide good foods, positive foods, in order to help this person regain their own independence. Just a moment while I get the Malanga, and I'll show you how you could confuse this Malanga and the correct Malanga to get. Before I forget, acupuncture has been used widely for many, many years as a treatment therapy approach for someone who has experienced a stroke, if you want to call it that, and or a wind stroke. You need to speak to someone in your vicinity who does acupuncture regarding what they could do pertaining a treatment plan. Food is definitely number one. Food therapy is extremely important in a situation like this. Herbs is another consideration. Here you have it, Malanga. Both of them look very similar to each other, and the confusion of picking up the right one means a lot. So I'm taking out the time today to show you specifically which one is the correct one. This is a root vegetable. and it has a similar texture as a potato. To the left of the screen is the Lila Malanga, or you could say the purple top Malanga. Are you noticing it has a purple or lilac color hue to it? Here you have the idio. The idio is the one. I do not recommend that. That's more starchy. Forget about that. That's no good. We're looking at the Lila Malanga, and this is the Malanga that I strongly recommend for someone who's trying to change their diet and have something that's gluten-free and that will assist you in a great way. Low glycemic index, blood pressure, muscle cramps, strokes, kidney disorder, blood pressure. It has B vitamins, potassium, fiber. I've just listed off a few. So there you have it. Lila Malanga is the best choice. Click the subscribe button. Help this channel generate views by sharing. And thank you. And come back and join us again soon.